Josephine, and the title of her project is Bridging Gaps in Maternal Pelvic Floor Health, an occupational therapy-led educational and advocacy initiative.
Okay, perfect. Good afternoon, everyone. My name is Josephine Aduba, and I did my capstone project on pelvic floor therapy with a focus on maternal health, and it's titled, as Dr. Renner said, Bridging Gaps in Maternal Pelvic Floor Health, an occupational therapy-led educational and advocacy initiative. So really my purpose in driving forth for my capstone project was to advocate for occupational therapists to be on the front lines of pelvic floor therapy. Pelvic floor therapy in general is primarily dominated by physical therapists. So altogether, as occupational therapists, we're gradually making headway into pelvic floor therapy by bringing awareness to what pelvic floor dysfunction is and promoting what pelvic floor therapy has to offer from the perspective of an occupational therapist. As a part of my capstone project, I created educational resources as my way and contribution to helping bridge those existing gaps. So before I go further, here are some of my deliverables or the educational resources I created. I created a pelvic floor educational toolkit, and this is more so in depth with what pelvic floor dysfunction is, what occupational therapists have to offer in the specialty, and then also going into depth with like strategies and modifications that any woman in the maternal health population could utilize to her own advantage. And then my pocket resource card is more so like a mini version of my educational toolkit, but the purpose of creating this was more so if someone doesn't want to go through my educational toolkit, which is fine, they can read my pocket resource card and still pick up meaningful information. So I'm going to go ahead and pass these out. And then my capstone site was based in Denver, Colorado, and it's called Posture Power Wellness. The owner and my capstone site mentor, Sherry Barda, is an occupational therapist who's been practicing for more than 20 years. She left the clinical traditional model and practiced as a Pilates instructor. And then after some time, she started her own Pilates studio. I had the pleasure of visiting Posture Power Wellness in Denver, Colorado during my second week of my capstone project. And as a part of my deliverable, I did a assessment on the Core Rehab app. And the Core Rehab app is something that her clientele use. So what that really consists of are exercises and educational guides that any of our clientele who choose to use it and pay for it can utilize it in the comfort of their own home. So the purpose of my assessment was to really review the Core Rehab app, look at things that can be strengthened or that can be eliminated, just altogether to increase the usability and accessibility for her clientele. So feel free to read it. Thank you, ma'am. And then also, as a part of my capstone project, another one of my lovely deliverables was taking a Lindsay Vessel Level 1 Functional Pelvic Health Practitioner course. I did that throughout the 14 weeks of my capstone project, and the purpose of me doing that was to really strengthen my clinical competency in pelvic floor therapy and just how to combat pelvic floor dysfunction as an occupational therapist. Moving forward after graduation, I really do intend on becoming a pelvic floor therapist and just really building upon the knowledge that I've gained throughout the 14 weeks and also beforehand. Throughout my 3 years here, I've had a lot of exposure to pelvic floor therapy by choice, which I really appreciate. So just in my clinical career, I really hope to build on the information and knowledge that I've gathered during these 3 years, and then also do more in the community surrounding women's health, pelvic floor health, and maternal health. So I completed it, and here's my certification. Thank you. No, I'm not done. Sorry. Oh, sorry. So throughout my literature review for my capstone project, gaps that I came across that were kind of glaring to me was a lack of education and the awareness surrounding pelvic floor therapy and pelvic floor dysfunction, which again, part of my purpose for my capstone project. And then the stigma surrounding pelvic floor dysfunction, some of the information that is misleading out there geared towards women, and then also the high demand for pelvic floor therapy and its low accessibility. So really, again, the purpose and my call to action moving forward was to just really bring awareness to what occupational therapists have to offer. And one of the biggest things that I've taken note of throughout my whole entire journey is I follow a few Facebook groups that talk about pelvic floor health and maternal health. And really one big thing that actually drives my inspiration is the fact that there are PTs and OTs all together who are really advocating for rehab programs in the hospitals on a labor and delivery units and postpartum units to again increase that accessibility for women, so that they're not left alone having to, one, suffer in silence, but then also figure it out on their own when services like that are provided right next door to them. And that concludes the end of my presentation. Questions? Concerns? Anyone? Dr. Creston?
So I'm a physician and I'm trying to understand the difference between what pelvic health rehab might look like from a PT versus an OT. Mm-hmm. What would you say is the distinguishing feature for OT?
So I would say the distinguishing feature between occupational therapists and pelvic floor therapists with pelvic floor therapy is that as occupational therapists, we look beyond the physical deficit or physical impairment, and that being pelvic floor dysfunction. As OTs and also as a part of this program, we're taught from the very beginning to look beyond that and consider other components that are impacted by pelvic floor dysfunction, because I'm sure all of you have suffered some type of physical deficit, and so it really does impact your social participation, your engagement in just like the things that we take for granted as able-bodied people. So as occupational therapists, we provide modifications. We can provide exercises, which is like the basic, but we go beyond that. Dr.
What was your favorite part about the pelvic health certification you did?
I would say the favorite part, or my favorite part, was the labs that we had at the very end of our course, and that was just really all of us putting it all together. The TAs that were a part of this course were really helpful and really took the time to work with us as students to go through the skills to assess for pelvic floor dysfunction, some of the core communicational principles that we implement as pelvic floor therapists, and just really all together working as an OT, because a lot of what's out there are just kind of like PT related pelvic floor therapy courses or education, and hardly do you find or come across like OT based. So I just really appreciated how like all of them were OTs, and like I could relate because I was an OT student, but it was just like reassuring that there are practitioners out there who speak from my profession. That's really what I liked. Did you have
I'll ask the last one if you want. Well, I don't know if you want, but I'll ask it. What was one experience you had or technique you saw or something along those lines that you really look forward to bringing into your professional practice when you become an OT?
So a technique that I got from the course itself was something honestly really simple, because going into it, I guess I was just kind of like, oh, there's so much to it. But then working with the TAs, one of them was just like some of the manual techniques that they utilize to help with constipation. Sometimes we just make it very complicated when it's not complicated. And one of those TAs that I personally had just told us, like, don't think too much into it. And it's all a journey. Like, you don't always have to get it all right just in one session or one evaluation, because some things will work, some things will not. That's why as OTs, we have that open communication with our clientele to see what's working, what's not working, and then what are more strategies or modifications that we can implement to make it work. So yeah. Thank you.